committee will come to order. Before I begin, I'd like to take a moment to address the guest in the audience. First of all, thank you for coming.
Thank you. Good afternoon. I wanted to start by expressing how honored I am to speak in front of all of you today. I hope by the end of my presentation you'll have a better understanding of the role of occupational therapy in addressing the mental health community. First, I will address the mental health crisis and its effect on the United States. Then I'll talk a little bit about occupational therapy, briefly describing our practice and how we service those in the mental health community. Lastly, I will propose a policy change to help occupational therapists become more recognized in treating those with mental health issues. It is no secret that our nation is facing a mental health crisis. From children to senior citizens, no one is safe from the despair of mental health problems. The crisis has only increased since the COVID-19 pandemic. Dr. Thomas Insel wrote in his 2023 article about the mental health crisis of America that there are 3 different crises happening right now within the scope of a mental health crisis. Those are mental health among the youth, serious mental illnesses or disabling disorders, and substance use disorders. In his article, he gives some shocking numbers that were collected from the Centers of Disease Control and Prevention about mental health in the youth, and their data shows that in 2021, 42% of high school students experienced persistent feelings of sadness or helplessness, and 22% seriously considered attempting suicide. Serious mental illness is categorized as either being mild or moderate, with diagnoses including schizophrenia, bipolar disorder, severe mood-altering and anxiety disorders such as depression and PTSD, just to name a few. In the same article from Dr. Thomas, he mentions that the biggest challenge is access to care. Many individuals with these diagnoses only receive treatment in jail and prisons, and without enough hospital beds or institutions, these individuals either end up on the streets, incarcerated and costing taxpayers more money, or they die by police shootings. It is also worth mentioning that, per his article, the life expectancy of those with serious mental illnesses is 20 to 25 years shorter than that of the general population. The last group of people under the umbrella of mental health crisis are those that have a substance use disorder. Fentanyl drug overdoses have skyrocketed. He mentions that the CDC reported 105,442 drug overdoses in 2022. Drug overdoses, alcohol-related deaths, and suicide have become the public health crisis of America, or that America was facing, with over 264,000 recorded deaths until COVID-19, where we experienced 1.1 million deaths because of the coronavirus. Right now, I'd like to shift gears and talk about occupational therapy. Occupational therapy, for those of you who may not be aware, is a type of rehabilitative service that helps people gain or maintain independence through therapy treatments or environmental modifications so that they can engage in occupations that are meaningful to them, thus improving their well-being and quality of life. Occupational therapy practitioners can help people in many settings with a wide variety of physical, mental, and emotional limitations. Unlike other rehabilitative services and professions, occupational therapists look at the whole person and provide a therapeutic treatment from a holistic point of view. Depending on the type of mental illness and its severity, many people with mental illness would find value in working with occupational therapists, as we are able to design interventions to help those return to activities that they do in their day-to-day lives, while managing their symptoms either through medications or psychological services. Occupational therapists are also educated in group therapy for mental health. We can work with multiple clients at the same time, addressing one or more issues while keeping people engaged and focused in functional activities, and build skills in motor function, mental processing skills, and social interaction. These 3 skill sets, along with interacting with group leaders and members, helps us as practitioners ready these individuals for community integration. Although occupational therapy practitioners can help, they are often overlooked by the insurance companies and healthcare professionals because of their lack of knowledge about occupational therapy's role in psychosocial interventions. Abby Green, a student in the American Occupational Therapy Association's State Affairs Department, wrote in 2022, during the past several years, the profession has drifted away from mental health somewhat, and only about 2% to 3% of practitioners working exclusively in this area. This drift away from mental health services puts potential clients at risk of not receiving quality care, as wait times to speak to psychological professionals in person increases, and online platforms like BetterHelp become congested with new clients. Licensed occupational therapy practitioners cannot diagnose someone with a mental illness. However, they can recognize symptoms, make referrals, and address those symptoms through a array of interventions and techniques such as group therapy, mindfulness, cognitive behavioral therapy, etc. There are a couple of legislations I want to mention briefly before I move on to my proposal. The first one is the OT Mental Health Parity Act. This recently passed in 2023 with the Senate Finance Committee, and it helps occupational therapy practitioners provide services to people with mental health or substance use disorder under Medicare. The second legislation I want to mention is in 2022. Under the current administration, the Bipartisan Safer Communities Act increased federal grant funding to each state to implement their own crisis intervention program. This funding was used to create better programs for those suffering with mental health problems, especially in schools. California took the lead on this by allocating $4.7 billion of their funds to create a program to support children and families suffering from or dealing with a serious mental illness. Although we've achieved some goals both at the state and federal level when it comes to OT's involvement in providing therapeutic services for those with mental or substance use disorder, the work is far from over. Occupational therapy is still not widely recognized today, and especially amongst healthcare professionals that provide services to those with a mental health disorder. I propose that we make changes to our healthcare policies to allow for joint evaluations for individuals seeking mental health services. This is how it could work. An individual schedules an appointment with their primary care physician seeking a referral for mental health services. They are sent two referrals, one for a psychiatric evaluation and one for occupational therapy. Once the evaluations have been assessed and a diagnosis determined by the lead psychiatrist, a joint treatment plan with both the psychiatrist and the OT is created. The individual will receive OT interventions to address daily occupational needs while also receiving psychological services. The difference between this plan and how we currently provide care is that occupational therapy will take on the less severe cases of mental health illnesses. Doing this will allow for psychologists to provide better and more focused services to those with moderate to severe cases of mental health and substance use disorders, improve quality of care for people seeking mental health services, and create more jobs for occupational therapists and occupational therapy assistants. I will close out this presentation by briefly summarizing some of my key points. The mental health crisis has hit an all-time high since the COVID-19 pandemic, sparking a rise in mental health issues, substance use, alcohol-related deaths, and suicides. As these issues continue to rise, healthcare professionals need to implement new strategies to help those in need of mental health services. Occupational therapists have knowledge in psychosocial issues and remain dedicated to providing services through their holistic approach. Although there are some legislations that have passed creating more opportunities for OTs to provide mental health services in their practice, there is still more work to be done. Splitting up the caseload between psychologists and occupational therapists could create more jobs for OTs and OTAs, provide higher quality of care for clients, and improve client outcomes. Thank you.